Hello everyone, Bismillah Rahman Rahim. Today we talk about a cough. Homeopathic treatment for cough is highly effective in most cases. Homeopathy uses remedy for natural for treating cough and they are therefore safe to use for person of all age group. These remedies work to treat the cause of the cough so as to bring about a complete recovery in a natural way. Homeopathy gives excellent results in acute as well as chronic cases of cough. Cough including dry cough, losing, rattling cough, spasmodic cough, all are wonderfully treated with homeopathy. Also, cough arising from various disease like asthma, bronchitis, and pneumonia is treated markable with a homeopathy. Along with cough, the attending symptoms like wheezing, difficulty in breathing, and shortness of breath also go away with the use of a homeopathy. So now I talk about some homeopathic remedies which we are use in cough condition. First remedy is Drosra. Drosera. Drosra is very effective homeopathic remedy for cough that is dry for using Drosra. A dry, irritant cough in the chief indicator. The cough comes in attack that follow each other rapidly. A marked fatigue attend the coughing episodes. Other occupying symptoms include tickling in the larynx, cramping sensation like in a sore throat, and fetid breath with the cough. Vomiting with cough may also arise. The cough usually risen after talking or laughing. Cough that appears during measles or following it is also treated well with this remedy. Drosera is also a well indicated for a cough that begins on laying down. This is also an important natural treatment for cough variant asthma. So we are use Drosera in our clinical practice. Drosera 30C, Drosera 200, and Drosera 1 m according to the patient condition. Next remedy is antimonium tart. Antium tart or antimonium tart. Antium tart works well in cases of rattling cough. The patient has a loose rattling cough and the lungs feel full of mucus. The cough remains constant throughout the day and night. The patient faces excessive difficulty in raising the balgam. Along with this difficulty in breathing, most marked at night time is present. Difficulty in breathing makes a person sit up from a prone position in which it is rose in addition to the above symptoms. A burning sensation in the chest may be present. Chest pain on coughing also arises in some of the cases. A cough that risen after each meal in yet another, further pointing towards the use of antium tart. So antimonium tart we are used in 30C, in 200C, and 1 m according to the patient condition. Third remedy is Coniummech. Coniummech for a cough rose at night. Coniummech is useful for nocturnal cough. The patient has cough at night on laying down. They are restless at night and tend to sit up many times due to coughing spells. A tickling sensation in the throat pit may be prominently present. A few individuals may complain of an unusually dry spot in the larynx. In some cases, a headache on coughing may arise. So, conium mech I always use in 30C and 200C according to the patient condition. So, fourth remedy is epicac. Epicac for cough with difficult mucus. Epicac is a suitable remedy for a cough with difficult. The patient has loose rattling cough with marked difficulty in a constricted feeling in the chest and shortness of breath may arise. Suffocative spells may occupy the cough, nausea and vomiting with the cough are also present in a majority of the cases. And also nausea, vomiting. So Epicac we are used in 30C, in 200C, and in 1 m according to the patient condition. So fifth remedy is Spongia Tosta. Fifth remedy is Spongia Tosta for cough with dry air passages. Spongia Tosta is a remedy that is highly useful when there is a cough with extreme dryness of all the air passages. The cough is an exhaustive, dry, barking, hacking type. Chills may attend the cough. Warm drinks may offer a little relief. Along with this, shortness of breath and lowered respiration may also be present. So, Spongia tosta is very good remedy we are used for dry cough. Spongia tosta I use in 6C, in 12C, in 30C, in 200C, and 1 m according to the patient condition. Sixth remedy is Crolium, Corallium, for cough from P&D post nasal dripping. Crolium is for cough that results for post-nasal dripping. The cough appears in quick short attacks that follow each other in quick succession. Along with the cough, excessive hawking is also present. Extreme exhaustion is felt along with the cough. A vital symptoms that attends the above symptoms are extremely sensitive air passages to air inhaled, air feel cold. So we are use this remedy in 30C and 200C according to the patient condition. So seventh remedy is millifolium. Millifolium millifolium for cough with bloody spota. Millifolium is of Millifolium is help in cough with bloody spota or in any lung disease with occupying cough. In addition, shortness of breath, difficulty in breathing, and oppression of chest appear. Hematoma after injury or following violent also indicate the use of millifolium. So we are use millifolium in 30C and 200C only. So next remedy is natrum mure. Next remedy is natrum mure. Natrum mure for cough with white mucus. Natrum mure is a good remedy. The spota may be salty to taste. Other attending symptoms are cough with the falling of tears from the eyes and headache of bursting nature and shortness of breath. A sore breast feeling in the chest also appears, and other symptoms that may arise in involuntary urination during cough. So we are use Natramure in 6x, Natramure in 12x, Natramure in 6C, Natramure in 12C, Natramure in 30C, Natramure in 200C, and Natramure 1 m according to the patient condition. Next remedy is Kali Sulf. Kali Sulf. Kali Sulf is valuable remedy for cough with thick yellow colored spota. Other symptoms pointing to the use of Kali Sulf are the rattling of mucus in the chest, difficult and wheezing in the chest. So Kali Sulf I use in 6x, in 6C, in 12C, in 30C, and 200C according to the patient condition. Next remedy is Pulsatilla nigra. Next remedy is Pulsatilla nigra. Pulsatilla Pulsatilla. Pulsatilla is an important remedy for cough where greenish mucus. The patient cough may get aggravated in a warm room and find relief in the open air. Pulsatilla is also suited for cough after measles. So pulsatilla I always use in 6C, in 12C, in 30C, and 200C according to the patient condition. So next remedy is phosphorus. Next remedy is phosphorus. 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 Phosphorus cough with sputum of a purulent nature, Fortly or blood-stained spotums. The mucus may be salty or sweet to taste. Strong odors may trigger a cough. Along with cough, chest tightness, oppressions of chest, and sharp stitching pain in the chest may be present. Heat burning sensation in the chest may also appear in a few individuals needing phosphorus. So I use only phosphorus in 30C and in 200C according to the patient condition. So next remedy is Heper sulf. HEPARSULPH. Heper sulf. Heper sulf is significant remedy for bronchitis in older adults. The symptoms indicating use of Heper sulf are loose, rattling cough with the thick yellow spota. The cough may rosen from cold air while warmth leaves in. So Heper sulf I always use in 30C, 200C, 1 m, 10 m, 50 m, and Cm according to the patient condition. So next remedy is arsenic album. Arsenic album, ARSENIC Arsenic album is an excellent choice of remedy for a asthmatic cough. The symptoms indicating the use of arsenic album are a cough with shortness of breath and wheezing in the chest, tightness in the chest may also arise of yellow green color, maybe mucus yellow green color may be there. Other attending features is suffocative attacks during sleep, anxiety and restlessness may in person along with above symptoms. So arsenic album I always use in 6C, in 12C, in 30C, 200C, 1 m, 10 m according to the patient condition.
Dr. Imran,
Yes,
I'm so sorry. Could you repeat Arsenicum album after the yellow green color mucus? You mentioned something, but I didn't catch it.
just a minute. Yellow green color mucus, other attending feathers is suffocative attacks during sleep, anxiety and restlessness in persons along with above symptoms. Arsenic album we are used in 6C, in 12C, in 30C, 200C, 1 m according to the patient condition. So next remedy is antimonium ars. Antimonium antimonium ars. ARSE. Antimonium ars is a remedy for treating cough in person having emphysema along with the cough, extreme extreme dyspnea, difficult in breathing attends in most cases laying down, rosen the cough, and dyspnea. Excessive mucus is also there with the cough. In addition, a general weakness and loss of appetite may be present. So I use this remedy only in 30C and 200C. Next remedy is Brionia alba. Bryonia, Brionia alba, Brionia alba for a cough in pneumonia. Brionia alba is beneficial for a cough in pneumonia patients. The guiding symptoms for using Brionia indicate a dry, hard cough and brick-colored blood streak spota, chest pain on coughing, which makes a person hold the chest in the chief attending feathers. Stitching pain in the chest, which is rose on inhaling, is another prominent symptoms for using bryonia. The chest pain may benefit from laying on the painful side. So I use this remedy, bryonia in mother tincture, bryonia in 1x, bryonia in 2x, bryonia in 3x, bryonia in 6C, bryonia in 12C, bryonia in 30C, bryonia in 200, bryonia 1M according to the patient condition. So next remedy is Sambucus nigra. Sambucus, Sambucus Nigra nigra for cough in children. Sambucus nigra is well indicated remedy for treating cough in children. The cough, the cough is usually of proxy, paroxysmal type. The most troublesome time of for cough is during the night. Sudden spells, mainly of suffocative cough, arise during night hours. A child needing Symbocus nigra frequently sits up at night because of the coughing spells along with the cough. Cough, a whistling sound from the chest, is also present in most cases. So Symbocus nigra I use in 6C, in 12C, in 30C, and 200C according to the patient condition. Next remedy is Seniga. Senega, Seniga. For cough in older adults, Saniga is of high value of treating cough in the elderly or treating in the chest with marked difficulty in rising. The tough spota arise along with the cough. Soreness, a press tension in the chest may also assist. Pain in the back on coughing could be present. A cough in asthma and bronchitis all indicates the use of Saniga. I use this remedy in 30C. Saniga I use in mother tincture, in 1x, in 2x, in 3x, 6C, 12C, 30C, 200C according to the patient condition. Next remedy is Cina, Cina. Cina is helpful when there is a violent cough that ends in vomiting. The cough is so intense that it brings tears to the eyes. The cough usually appears with attending shortness of breath. So I use Cina in 30C and 200C according to the patient condition. Next remedy is Coccus cocti, COCCUS coccus, CACTI. Coccus is useful when a spasmodic cough is rose in the morning. The cough ends with vomiting of mucus. Coccus cocci is also prominent when there is a cough in regular of much rupee mucus. So we are use this remedy in 30C and in 200C according to the patient condition. Next remedy is Nux vomica. Next remedy is Nux vomica for cough with acidity GERD. Nux vomica is an important remedy for a cough with acidity. The symptoms indicating its use are cough and difficulty in breathing with and with of gas in the abdomen, nausea, vomiting, fullness in the stomach, and sore, bitter bleaching are prominently present with the cough. This is a very a common remedy we are use in our clinical practice. Naxomica we are use in 30C, in 200C, 1M, 10M, 50M, CM according to the patient condition. Now I want to share a protocol which we are use in cough patients.
Dr. Imran, can you please clarify for Vivian if Nux is helpful with GERD?
Yes. Sorry, two more remedies. Rumex. Rumex for dry cough from temperature change from cold to warm or vice versa. Rumex is very effective remedy for dry cough that arises from sudden change of temperature from cold to warm or warm to cold. Cough happens from tickling irritation in throat pit. Another very specific indication to use Rumex is cough that occurs by inhaling cold air. In majority of cases, needing Rumex cough is most troublesome during a day. Along with cough, marked weakness is felt, headache during cough, sometimes few urine drops, escapes, involuntary during cough. So we are use Rumex, Rumex, Rumex in 30C, in 200C, 1 m according to the patient condition. So next remedy is belladonna. Belladonna, belladonna for cough day and night. This remedy is useful when dry cough day and night. It ushers from a tickling sensation in throat along with cough. The throat is red and inflamed headache may attend cough. It use in also recommended for cough that arises from inhaling fine dust in the air. So we are use belladonna in 6C, in 200C, 1 m, 10 m according to the patient condition. So belladonna we are used for high blood pressure, for headache, fever, sore throat, redness on eyes, redness on face. So belladonna is a deep acting remedy we are commonly use in our clinical practice. Now I want to share a protocol which we are use our clinical practice. So first protocol is Brionia 30C, Mayfighters 30C, Brionia 30C, Mayfighters 30C, and Seniga 30C mix together these remedies and use 3 times a day. Most of the time is more cough, then I repeat these remedies every 30 minutes, one dose until feeling better in cough.
Is the second remedy graphitis?
Mephitis. Mephatis. Mephitis. So next protocol is Gestatia 30C, Brionia 30C, Gestatia 30C, Brionia 30C, and Antium tart 30C. This protocol I use when mucus, mucus stuck in chest. So the mucus difficult to come out, then I use this protocol. So one more protocol for dry cough. Brionia 30C, arsenic album 30C, and phosphorus 30C. Brionia 30C, arsenic album 30C, and phosphorus 30C. Mix together these three remedies and use 3 times a day. So if suddenly start cough and also feel dryness of mouth, dryness in throat, and also patient feel fear for sudden cough, then I use this protocol Aconite 200C, arsenic album 200C, and belladonna 200C. Mix together these three remedies and use 3 times a day. So one more protocol for dry cough and also feel irritation in throat and cough rosen while laying. Reumex 30C and Chelidonium 30C mixed together these two remedies and use every 30 minutes until feel better. One more protocol: cough with dry mucus and difficult to come out. Brionia 30C, Epicarb 30C, Sulf 30C, and Coccus cocti 30C. Mix together these four remedies and use 3 times a day. Okay, and dry cough protocol: Carbovage 30C, Belladonna 30C, Aconite 30C, and Spongia Tosta 30C. Carbovage, Belladonna, Aconite, and Spongia Tosta 30C. Mix together these four MDs and use 3 times a day. So now I want to share a protocol for whooping cough. First protocol is Belladonna 200C, Brionia 200C, and Basilinum 200C. BELLADONNA Belladonna 200C, Brionia 200C, and Basilinum 200C. Mix together these three remedies and use 3 times a day. So anyone have a question about this topic?
Yes, Dr. Imran.
Yes,
Thank you
please.
so much. This is so informative. I do have a question. Um, what about on like an onset of cough? Would you use aconite in that case, like if you catch it right away? Or do you wait to see the symptoms play out a little bit?
First, we use aconite and arsenic album.
I have another thought. If someone's constitution, whenever they get sick, is tending to always come with a cough, do you think of the miasm tuberculosis?
Yes. First, we need to find the right miasm, like tuberculinum, if we need tuberculosis, or related with bacillinum, related with carcinosin. So, if tuberculosis in family, then we are use tuberculinum. Is asthma in family, then we are use bacillinum. If lungs cancer in family, then we are use carcinosin. Anyone have a question?
You
Okay, I
covered
want.
today mostly dry coughs. Are you going to do another day about wet coughs?
Sorry.
Today you covered a lot on dry coughs. Are you going to do another day with what more on wet coughs?
Yes, I think next Sunday we talk about wet cough, whooping cough,
Okay, amazing. Thank you
asthma
so
cough.
much.
Because this is a deeply, I want to talk about this topic in deeply and separately. So I think today, because of tonight, New Year, so members is busy. So just 7 members here. So next week, hopefully more people attend.
Thank you,
So now
Dr.
I want
Imran.
always welcome. Now I want to say thanks to everyone who attend this Zoom call. So next Sunday we meet with new topic, same time. And again, thanks to everyone and happy New Year to everyone.